The next speaker is Dr. Lokesh Patni from India. He's going to talk on simulation in urology. What do we have in future? Over to you, sir.
Good afternoon, everybody. So I'm going to talk about simulation in urology. What do you have in future? So basically, there are three phases of learning, which includes cognitive, which includes demonstration of the anatomy or the basics of the surgery, then didactic lectures, and book reading. Then the acquired knowledge is transferred into psychomotor action using practice. Then comes the autonomic phase, in which the person executes his learned skills on an automatic fashion without using much of your cognitive input. So these phases are to be practiced in OR. But as per the new norms, previously it was taught that the Halstedian way of see one, do one, teach one. But nowadays, there are many issues of time, patient pressures, consent issues from the pressure, financial pressures, changing technology, increasing complexity of the cases, variable learning ability of the students, and medical legal issues restrict the training opportunities. So simulators are required for training purposes, and they are becoming an important aspect of teaching curriculum. So at present, what we are having, we have animal labs, simulation labs, and cadaveric labs. They may be high fidelity, low and mid fidelity, may be computer-based, virtual reality or augmented reality. They may be bench models, fluoroscopy-based, fluoroscopy-free, and we have our own USG-guided simulator. So they may be biological, non-biological. There are many simulators which are present for percutaneous renal access. They are animal-based, they are bench models, vegetable models are described, and commercially available trainers are also there. But all these simulators have their own drawbacks. The augmented reality and the virtual reality simulators are very expensive to acquire even for the bigger institutions. The recurring cost is also more with these. So we came up with our own fluoroscopy-guided simulator, which is a mannequin-based model, and it replicates the 3D anatomy under fluoroscopy, and the student can practice fluoroscopy under fluoroscopy guidance, the percutaneous renal access. We have developed our own virtual fluoroscopy simulator also, and the student can learn in a radiation-free environment. The images are just as a real patient, and then these can be practiced at the office space also. So the trainees can be taught 3D orientation and depth perception, as well as identification of the posterior calyx, and all techniques of PRS can be practiced. So the ultrasound-guided simulator for renal access, it also simulates the real tissue field, and the student can practice even puncture or biopsy, renal biopsy can be practiced. The next step for teaching is the stone manipulation bench, in which the student can learn how to manipulate the stone in a real-time fashion. This can be practiced in OR. So in our concept, we had break the steps of, say, percutaneous renal access or PCNL into micro simulation. So that goes with lectures. Then each step of the surgery is taught to the student, and then finally the OR experience is provided. For ureteroscopy, there are many available simulators with a good tag price over them. So we have developed our all-in-one sim, which simulates the real-time patient, and you can practice laser disintegration of the stone, as well as basketing of the stone, cystoscopy, and other procedures. For TURP, we have virtual reality models available. We have made our own chicken sausage-based TURP simulator that simulates the real tissue field, and the other procedures also can be taught on the simulator. We have developed a lab simulator for practicing lab in our setup, there are many available laparoscopy simulators which can be used. They all are not easy to acquire. So these are the cheaper version for the region like us, where cost is always remains a big constant for all of us. So the simulation programs have been integrated into Europed programs. We started it at our institute, and then we collaborated with National Society, the Euromet, which is held twice or 4 times a year for simulation training to the students. There are zonal meetings, state meetings, and many webinars are there. Overseas, we have association with Singapore Urology Society of Asia, Arab Association of Urology, few textbook chapters, and finally the simulators can be used for teaching the students in vitro experiments and instrument demonstration. Handling of the instruments can also be taught. So we all have to walk up the odds and continue to strive for better. For the future, I would say that the future of simulation will integrate all physical, real, and augmented versus, as well as virtual reality into a same model to make a comprehensive model which is easy to acquire and it is cost effective for the student learning. Thank you very much.